Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation. And today we've got kind of like a health tech legend here in the co-founder and CEO of Story Health, Tom Stanis. So Tom, great to have you here.
Nice to see you, Jessica. I love your show and I'm happy to be here.
Thank you so much. Well, it's a pleasure to talk to you. And I say that you're like legendary health tech. You're co-founder of Verily. I mean, you have a Google background, and so does a lot of the C-suite over there at Story Health. But this is like the brand new baby here that came out a couple of years ago in December of 2020. You've got some great backing from some really great investors. I know General Catalyst, Divine Ventures, B Capital is in your Series A along with North Pond Ventures. So you guys have some really great backing. And what's interesting about what you're doing is that you're kind of taking this whole approach that we've seen over the last couple of years of taking virtual care and remote patient monitoring, care coordination done, via telehealth, and layering that into specialty care, which is pretty unique. We've seen it a lot in primary care. We've seen a ton of it in chronic condition management, but specialty care has been kind of one of those, it seems like off limits areas for technology. So I'm curious to hear, give us the basic intro to Story Health, and then let's unpack all of this.
Right. Yeah. So your kind of way that you described it is exactly right. We're trying to bring the great experience for a patient where they're actually getting this continuous care to the world of specialty, where it's really hard, frankly, to get a hold of specialists today. They are way overworked. There's not nearly enough of them, and they're dealing with really sick patients that need this kind of solution even more than you do for your PCP, right? These are patients that are in and out of the hospital, that are spending a large amount of money with the health system, right? So the more we can help them, the better we can do. But it means we have to be even more sophisticated and understand these diseases in a much deeper way to be able to treat them very well. That's what we're doing at Story Health. So that really begins everything from identifying where the patients are in the EHR, to helping create these dynamic care plans, to getting them implemented with patients beyond the clinic setting.
All right, so we can unpack all of that. And I want to start is kind of where you guys have started. So my understanding is like the first real instance or case study that you guys are working is within cardiology, specifically within heart failure patients and those who have refractory hypertension. So give me a little bit of insight. Why did you guys decide to start there?
Yeah, so we did our research and we did our homework, and we found that the academic community had figured out that there's this massive treatment gap, especially in heart failure, where there's multiple medications that have been discovered over the last 10 to 20 years that have a tremendous effect, but they're way underutilized in practice. And in fact, only less than 5% of heart failure patients are actually on guideline-directed therapy. It's really sad, because you can actually reduce the chance of hospitalization by 50, 60% if you actually get them on the optimal therapy. So that to us was a big calling, saying, well, what can we do? And in many ways, our thesis was that this was a logistics problem. It wasn't a problem that doctors didn't know. It was that they weren't able to do it with this seeing patients in the clinic every day. You have to do a lot of titration. You have to watch for a lot of side effects. Hard to do when you're only seeing somebody every 3 months. So we moved that whole process out of the clinic and have been able to do that very successfully outside there. And we've been able to drastically reduce the admission rate for our patients. So our heart failure 30-day all-cause readmission rate is 7%. That's like world-class, right? That's
wow.
Yeah.
That's incredible. Oh, and okay, so say a little bit more about exactly how you guys are doing that and the role that technology is playing. And it's like I'm very curious about this, because it's like what you just said, people won't see their doctor for 3 months, and instead there's so many different opportunities and so many different signals that are coming from their body and symptoms that will go unrecognized. So where have you implemented technology on the patient side of this so that there are those signals that a clinician can respond to intervene more quickly?
Yeah, the way I think about it is that we take a very technology-powered, but technology-enabled, but human-powered approach, right? So the technology enables patients to be able to report symptoms regularly, like you'd want to do, because you might have lightheadedness from some of these medications. We actually do home vital signs, which is, we don't actually build the platform for that, but we interpret all the data and bring all that data together. We help people with getting labs and getting pharmacy access. A big driver of this is just that access problem, where getting to the lab when you work an hourly job can be really difficult. So we send people to your home to draw your blood for you, right? Much more convenient. Or even getting to the pharmacy and finding out your meds are $900 for your copay. Who wants to deal with that? And how do you deal with that, right? Really difficult. So we built technology that allows us to automate a lot of that process so we can figure out what's the coupon card that could work for you, or is there a pharma assistance program that we get you enrolled in? All that stuff really has to come together to help a patient to be able to get to the goal of like the best treatment possible, and do that very quickly. We try to do it on a 2-week schedule actually with a patient, where we're actually optimizing therapy every 2 weeks based on the previous 2 weeks of work.
All right, and say a little bit about the clinician side of that, because one of the things that I was really impressed with when I was taking a look at, your website and kind of going through like the different demos that are on there is just how user friendly this makes those, like the different clinical guidelines, like how much sense it makes out of those in terms of streamlining what the clinician needs to look at. So it's just the most important information. So say a little bit about that and how purpose built that was.
Yeah, right. For the clinicians, they're dealing with a big challenge of an electronic health record that has a lot of data in it, that's all over the place and takes a lot of time to interpret, right? So they're clicking all over here trying to figure out, what's this patient's ejection fraction? I know they're a heart failure patient. Like, are they, when was the last time that they had this done? And all those questions are easy for computers to answer, but difficult for humans to do, right? So we built a system that really understands the disease and then builds a disease-specific view integrated in the EHR of exactly what they need to see. That also brings in all that home data that I talked about how is the patient actually doing and adapting over time, right? That is a kind of very unique way of looking at things that most clinicians do not have the luxury of having, unfortunately, today. In addition to that, you can actually bring in the guidelines intelligently into that situation where you can say, hey, based on where this patient's at, this is where we should go next, right? Let's help you make it an easy road into where the guidelines say you should go, and assist the clinician to be able to do that, and really make them what I think of as like conductors of the orchestra rather than like, paper pushers, which unfortunately, like many people are getting burnt out spending so much time just doing logistics, right?
I'm curious about that piece of it too, because and maybe you can speak a little bit to some of the clients that you guys are actually working with. I know you guys just signed a partnership deal with Intermountain, so I'm not sure if you're fully rolled out there yet or not. But even with those that you've already worked with, on that clinician uptake side, what we saw with digital health point solutions or with some of the virtual care, integrated into primary care, is like that clinician experience. Sometimes like there's pushback in the sense that it's like, well, okay, they're so burned and burnt out literally by what happened with EMR that it's like this whole fragmentation, the point solutionization of healthcare, there's a little bit of pushback in terms of it making it worse. How have you guys worked to make sure that this isn't the case, and particularly with this really overbooked, overworked subset of clinicians in terms of specialists?
Yeah, so I mean, part one is we didn't actually build a separate EMR. We built into the EMR they're already using, right? So they don't have to log into something separate. They don't have to re-enter data. It just, they click on the Story Health button and they see what we call our storyboard. What's going on with this patient in the context of their disease? That's a very different experience than the point solutions you're used to, right? It's all the data kind of goes back and forth rather than it being this like, oh, I have some report from some third-party thing that did something to my patient that I don't really understand, right? That's, I think, really key. Part of it is it's a partnership, right? We actually work deeply with these specialists on a day-by-day basis. We know what the appointments of patients they have that are coming up, that are patients that Story Health is helping with, and our health coaches that are working with the patients on day by day are actually, talking to the doctor saying, hey, this is what's going on. This is what you should expect in this visit, right? So it's really an extension of the team rather than something bolted on the side. That I think has made all the difference for us.
That's so interesting, because that was one of the things as I was doing my research on you, is like in your initial seed funding, I think it was Hemant Taneja from General Catalyst had said that you guys were really rebuilding the entire care model for specialty care. And I do think like that when you say it that way, where it's like you're an extension of the care team, I think that is really interesting. Here's where I want to ask about what you've learned, through your experience being a co-founder in Verily, because I think that this is where, we can glean a lot of insight from you, Tom, in the sense that it's like technology is like, you can digitize whatever, the paper that goes on the clipboard and make it into
Right.
the EMR, right? But that's not really the best and most optimal use of technology. And I love what you said earlier about, some questions are the answers are hard for a human to find, but it's very easy for a computer to answer. Can you give us like a little bit of, I'd love to hear like your thesis, like your thinking in terms of how you're approaching from a real macro level, the way that you're integrating technology into different parts of the process. How do you decide, like, yeah, we should be relying on AI and the tech capabilities versus no, we need to intersect this process with a human. There needs to be a
Right.
human here talking. How do you think about that? I'd love to get like just some of the
Yeah.
high level strategy behind that from your brain, especially with such success in your career doing so.
Well, it's definitely something we've had to figure out. One of the things that we built early on at Verily was this thing called for diagnosing diabetic retinopathy, one of the leading causes of blindness from pictures of retinas. And the way that we did that was we really relied on ophthalmologists to tell us like which of these images is a severe disease versus potential disease versus none. And I think that's a really important part of the process. And remember, our goal here is to do as good as, if not better than humans do, right? So if you're going to do worse, I think it's tempting from people like a tech background that first come into this to be like, it's good enough. And that's just not true. Like, we're dealing with people's lives. Like,
Yeah.
we have to have a higher bar than that. So validation is a really important part of this, right? So you have to think about the full life cycle of each of these things. And I like to say, like, begin with making the clinician's job easier to make the decision that they only can make. So they're spending all their time making the decisions, right? And then slowly try to figure out, okay, which decisions are easy to make that we don't need to ask them about, that we can start to automate away, and just like slowly improve, but always keep them in the loop, where there's always this kind of like understanding that, frankly, patients are unique. They all have different situations. They are complex. So do not assume that there's like this cookie cutter approach that's going to work for everyone. So I like to think of it that way. It's like start to assist, figure out where you can make quick decisions, but always keep this idea in the back of your mind that like there needs to be an escape switch where you can say, no, that's not how we're going to do this.
That's really interesting because I feel like it lets there be the art along with the science in terms of practicing medicine, which I think is what a lot of the clinicians, that's often a criticism of technology, is
Yes.
that it kind of starts to take that away.
Right.
In terms of being mindful in that, are there any like, I don't know, can you give us any like tips or tricks, or like how do you maybe even just weigh in on where you see a lot of health tech companies, kind of going sideways? Like, is there like this tendency to, oversimplify, like maybe like you kind of just alluded to, or
Yep.
like not include that escape route out? Like, what are some of the common things that you're seeing, especially as we look post-pandemic, what's kind of happened since the
Yep.
rapid and quick adoption of virtual care and digital health solutions, specifically in chronic care, and what we're kind of learning and watching models start to
Yep.
adapt to a place where they're actually much more integrated into the health system and integrated into care pathways and things like that. What are you seeing out there, like common mistakes and like common things that are done well? I'd love to hear.
Oh, I think the things that people make mistakes on, one is this assumption that let's run to the simple problems, right? Which I think, yes, low-hanging fruit's good, but like we never really get to the crux of the issue if we only deal with patients that are frankly well, right? They have conditions, there's things going on with them, but there's patients that need a lot more, and that's actually where I think we need to focus. But the complexity is a lot higher, so you need to run towards the complexity. I think that's something that I think people miss out on. So they're like, oh yeah, we're managing patients with this condition, like, but do you realize every heart failure patient probably also has hypertension, and they have diabetes, and they have renal issues as well? So like, you can't ignore that. That's, I think, a condition, a challenge that I think a lot of people are missing, that you really need to do. The other thing I think that, let's see, other things that I think that there's also this tendency to be like, well, we know the technology is hard, so we'll just replace it all. We'll just build more humans into the system, and we'll just kind of like use our funding to drive a very mechanical human process that never really generates the margin that you need in order to build a business, right? So you end up with tons of money, venture money, that's gone down the drain that way, where it's like Did you actually ever build anything, or were you just like pouring more money that was never actually going to build a business?
I think that's okay. That is a fair point. Now that begs the next question. And so, how is that not playing out at Story Hub?
Right.
Like, because that's the trick here, right? It's like, how do
Yeah.
you use the technology to, improve the experience and also eliminate some of the costs where it makes sense, and build a successful business that is revenue generating. Like, how
Right.
do you do that? And that's like, there are big tech companies out there, like, it's like, out of the healthcare industry. Like, let's look at Uber for a second,
Sure.
and that still haven't figured that out. And then you add the complexity that is healthcare around
Yeah.
it, and the disintermediation of payers and things like that. So how are you guys making sure that you are still building a scalable revenue generating business at
Yeah.
Story? Like, tell us a little bit about that side.
Yeah. So I think scalability has to be one of your core values, right? You have to think about everything from that lens. And that means one of the things we did at Story is the entire patient experience can be run with no human interaction. Now, that
Okay.
very rarely happens, right? Most people need somebody to talk to, and they're going to need some help. But if you assume that like you want to build that as an option, it forces you to think through all the points where it could break down, right? That's like one of the, I think the founding principles you have to think about is like, how do I make sure that the whole process could run with less humans? And then you have to start measuring, like, this is actually, it sounds simple, but a lot of people don't even measure what their ratios are, or their margins are, or they're like, or how much time is going to this or that. Crucial that you actually watch this stuff and you're digging into it all the time. It's funny, as an engineer, it's always, I love to work on the product, and I love to roll up my sleeves and get into things. But these days, what do I spend my time actually doing from a technical perspective? Actually looking at the data and seeing where we spend all our time. So I think all the way up to the top of your leadership, you have to be, that has to be like something that you care about deeply is, what are we spending our time on, and how's that going, right?
That's really interesting. But it even sounds like you're taking a very like engineer approach to
That's
doing
right.
just that with all of
Yeah,
your
I can't
measuring
escape
and
my engineer roots at
no,
all.
you can't. I love that. I think that that's great. All right, so give me a sense then, Tom. Like, let's kind of talk about what's next for Story. I'm curious about what's on the docket for. And let's talk long term, because I'm curious. Like, are you guys? I mean, the investors that we talked about that have backed you thus far are notorious for loving their platform plays.
Right.
So, like, once you figure this model out within, heart failure and refractory hypertension, and like, own cardiology in terms of the virtualization of that particular specialty, do you guys move on to another one, or do you like just continue to refine the product here and move into different aspects of cardiac care? What's the plan long term here?
Yeah, so we always took a platform approach when we built this from the beginning. And in fact, many of the components that fit into the solution, things that I mentioned about like drawing blood at home, being able to change medications on the fly, these problems exist across all the specialties. They are not unique to cardiology in any way. So there's obvious, adjacent diseases that make a lot of sense. I mentioned that like every heart failure patient also has diabetes and renal disease. Obviously, those make sense as areas that we would potentially add on. I also think of it though as it's a whole patient solution rather than specialty by specialty. In fact, that's one of the things that longer term I would love to figure out a way to solve is how do we reduce the siloing in medicine and figure out like what is the treatment program for somebody who has metabolic disease, which is multifaceted, right? That's something that we see in the future. That's from a clinical perspective where I see us going in the future. From a business perspective, right now our partnerships have been with health systems. So ChristianaCare was our first. Intermountain we just announced recently, and there's many others coming over the next year. But I start to think then further down the road of, well, who actually is going to get the benefit from all this from a business perspective? Certainly, we're going to help health systems fix their revenue problems and help them keep their patients engaged. But in many ways, we're keeping patients out of the hospitals too, right? So over time, I expect that whoever's holding the risk for these patients medically is really going to benefit for the work that we do. So longer term, I actually want to really drive down the cost of care by doing this and being more thoughtful about keeping people out of the hospital. That's the true long-term vision for where this is headed.
Well, that's incredible, Tom. I think that sounds great. And it's exciting to watch somebody, and not just you, but the rest of your leadership team as well, with such track records for doing this in other aspects of healthcare technology, that it's like, yeah, I think the rest of the industry is very excited to see where Story Health ends up going, and what you guys end up doing in that regard, and the areas that you'll end up into. I'm very interested in this whole
Right.
diabetes and renal aspect. There's a lot of ways that you can add on very quickly
Right.
by not necessarily building, but yeah, buying your way into there. So we have to let us know what goes on as you guys continue to unfold along that strategic plan. Last thing for you, what's ahead in 2023? I mean, that's like a big audacious kind of goal, like down the
Right.
road, right? Like that's where you guys are headed. But like in the near term, you mentioned the Intermountain partnership that'll be rolling out, some others down the road here. But like what else? What else is on the docket for 23?
Yeah. So one of the things that we're doing that is very unique in digital health is Duke is actually our partner in clinical research, and we actually just kicked off a randomized control trial,
Of
which
course.
right, uh, which people in digital health don't do. We don't actually have good evidence that these things work. So that's actually, especially in specialty, where specialists are really skeptical about new ideas, because there's a long history of like medicines that didn't work. So we want to do that and show that not only does Story Health work against control, I mean against baseline, but it actually improves versus people that were randomized into not receiving Story Health. So we'll be enrolling that over this year, and we'll be reading out hopefully in 24 on that.
Awesome. Well, that's exciting. Well, we will look for that as well. And Tom, thank you so much for taking the time to speak with me today. It's inspiring to hear you talk not only about Story Health and the business that you're building there, which is really pretty revolutionary, but also to hear about your background and the way that you approach and are approaching these problems of integrating technology into healthcare. I mean, I think it's such a different approach, and I really appreciate you kind of walking us through your thinking and how you guys are approaching that. I really appreciate that.
Thank you, Jessica. It was a pleasure to speak with you.
All right. Well, everybody, that's Tom Stanis. He is the co-founder and CEO of Story Health, also formerly a co-founder of Verily. I guess, well, once you're a co-founder, you're always a co-founder, right, Tom? But we got to pick his brain here today. And for more interviews with those who are changing the way that we do healthcare, you can head on over to my YouTube channel. It's youtube.com/WTF Health. I'll talk to you guys really soon. Tom, thank you again. It was a pleasure to talk with you.
Thanks, Jessica.
All right. Bye, everybody. We'll see you soon. Take care.